Okay, this is chapter 16b and the chapter on leaky gut, and we're going to go into more detail. We're going to talk about something called amyloidogenic clotting. We're going to talk about dormant bacteria, reactivation of dormant bacteria. And again, this is a subject that is really not hardly known at all to conventional medical doctors, allopathic doctors, MDs. And they really ought to know this. And you might have heard me say this before, but I'll just mention it for the people who haven't heard it. I talk to infectious disease doctors. They're pretty nice. But, I ask them, what do you think of dormant bacteria, reactivation by iron? They just give me this blank look. They don't know it. And it's the same problem as you see in other areas of internal medicine and internal medicine subspecialties. They're tested for their boards based on the textbooks, and their textbooks don't have a lot of the most important, most basic information. Anybody who knows anything about infectious disease knows there's a lot of dormant bacteria. There's dormant tuberculosis, dormant syphilis, dormant Lyme disease, for example, and there's other bacteria that can even live inside of cells. Okay, so what we're going to talk about here today, though, is especially amyloidogenic clotting. Let me center this picture a little bit better here. Okay. So when you have leaky gut, I had an earlier slide in this chapter, 16a it was called, where it showed that when there's leaky gut, bacteria can get into the blood. Okay. These bacteria, by the way, they cannot grow if they don't have iron. If there's not an adequate amount of free iron in the blood, they can't grow. So the body sequesters iron to prevent these bacteria from growing, but they can remain dormant for a while. So they're not dead, but they're not proliferating either. When increased free iron becomes available, they then can proliferate. So basically, let's say you have a liver injury. The liver stores a lot of iron. When you have cells in the liver die, they'll release their iron into the blood, and that can acutely raise iron levels. In general, men start accumulating iron after they're 20 years of age because they're done growing. Women tend to start accumulating iron in a significant way after they're postmenopausal. And it's a big deal to sequester iron. We're going to talk about why that matters here in just a moment. Gram-negative bacteria, their endotoxin is LPS, lipopolysaccharide. Gram-positive bacteria, their endotoxin is lipoteichoic acid, LTA. Okay, it's an incredibly amplified autocatalytic mechanism by which LPS and LTA can cause fibrinogen, the blood clotting protein, to change its secondary protein structure from being cylindrical, it's called alpha helix configuration. They can change then to becoming flat, beta pleated sheet. And the bigger a molecule is, the more likely it is to precipitate out of solution. The body is basically primarily in an aqueous solution, water-like solution. And when these molecules get real big, again, they can precipitate. A protein is only useful while it's soluble. When it's precipitated out, it's no longer functional. Okay, so anyways, when they precipitate out, part of the process of their clotting is they're clotting in this beta pleated sheet configuration, and these clots are much more difficult to lyse. The body's always forming clots, dissolving them, forming little clots, dissolving them, and this is pushing the balance towards more clot formation and more prolonged clot formation. This is called an amyloidogenic transformation, when a protein goes from being alpha helix to beta pleated sheet and starts stacking up. So this is amyloid clotting, amyloidogenic clotting. And again, these clots are hard to dissolve. Douglas, Kell, and Etheresia Pretorius are two researchers who've done a lot of work on this. And so you worry that when you're forming a lot of these clots, they could potentially be traveling to different parts of your body and plugging up small arteries. Okay, you don't want that. If they plug up small arteries in the brain, they could potentially have cognitive symptoms. If they plug up small arteries in the heart, it could potentially have, shortness of breath on exertion, things like that. And it's also the case that infections, like viral infections and viral-related things, will increase the tendency of this to occur. So I don't know if you understand what I just said, but that's a big deal. Okay, because I think a lot of people, most people in my experience, don't know much, and they tend to think everything's okay, everything's okay. They don't understand all of these things are working together to predispose you to forming clots, and clots are the main reason why people get sick. A clot in the artery of the heart will cause a heart attack, myocardial infarction. A clot in the brain will cause a stroke. And clotting in other spots will cause dysfunction of the tissue. You get a clot in the artery of the eye, you go blind. You get a clot in the artery to your hearing apparatus, you can lose your hearing. A lot of the problems that old people have when they're old is just because they have a lack of blood supply to their different tissues. total body ischemia. Okay, so we're going to go into the implications of that, but that's really important to remember. LPS, gram-negative bacterial endotoxin, gram-positive bacterial endotoxin cause amyloid clotting of the blood by distortion of the fibrinogen shape, the fibrin shape. Okay, iron can also do it and lead to distortion of the fibrin shape. So there's, 3 things predisposing to clotting. Well, guess what predisposes to clotting? If you're eating a high-fat meal, that's a 4th thing that predisposes to clotting. If your vessels are constricted because of a lot of sodium, that's a 5th thing that predisposes to clotting. Okay, if you're dehydrated, that's a 6th thing that predisposes to clotting. If you have an active infection, bacterial infection or viral infection, that's 8 things predisposing to clotting. If you have increased psychological stress, that's let me try to get my hands here. It's confusing when I look at the webcam. That's 9 things predisposing to clotting. If you also are sleep deprived, there's 10 things predisposing to clotting. Psychological stress, caffeine, they're all increasing your risk of clotting. So you have a deficiency of potassium, magnesium, you're increasing your risk of clotting. So all of these things, you're taking calcium supplements over 1,400 milligrams a day, you're increasing your risk of clotting. So this is why a lot of people have problems. They don't even know what's happening. It's because they're being nickel and dimed to death by 10 or more things going in the wrong direction. And all of these things are avoidable. Stay reasonably hydrated, okay? Avoid the things that cause leaky gut. Don't be iron overloaded. Even donate blood if you need to get your serum ferritin down. So these are all doable things. And what I'm trying to say is some people are having long viral symptoms, and some of it might be related to this, as put forth by Douglas, Kell, and Pretorius. And by the way, I think Douglas, Kell, and Etheresia Pretorius are brilliant. I think they're like geniuses. They did some great work. And Douglas Kell's got some good lectures. They're like an hour long, like a systems approach. And he goes through all this stuff, and it's really interesting and I think useful to know. Okay, he's from England and she's from South Africa. Okay. So, yeah, that was a key point we made, that bacteria need iron to grow. That's something that you should always think of those things as together. That's a real key fact. Okay, we talked about LPS being the gram-negative bacteria endotoxin, LTA, the gram-positive bacterial endotoxin. I'm going to go into some of the research papers here in just a moment. And so that was the background information to make sense of this stuff. Okay. Okay, so this says acute induction of abnormal amyloidogenic blood clotting by molecular amplification of bacterial lipopolysaccharide. So what he's basically saying is bacterial lipopolysaccharide, LPS, gram-negative endotoxin, causes a dramatic tendency to shift the fibrinogen to beta-pleated sheet configuration and these dense matter deposits, difficult to lyse clots. So, high-fat diets that are low in fiber predispose to leaky gut, as well as all those other things I listed earlier in this talk. There's so many of them, it takes time to go through them. So and then people will pretty routinely eat a meal that's high in fat, high in iron, high in sodium, and low in fiber, low in potassium, low in magnesium. They're doing everything to predispose themselves to these problems, okay? All right, so now we're going to talk about something called toll-like receptors and insulin resistance. Okay, exogenous fatty acids, that means from your diet. Endogenous fatty acid means from your body, from your own adipose tissue, with sort of fat spillover, if you will, releasing fatty acids into the blood. These also contribute to increased insulin resistance and potentially to increased tendency to clot. Toll-like receptor number 4 contributes to the development of insulin resistance and inflammation through activation by dietary fatty acids, enteric lipopolysaccharide, that means from the gut, LPS. So that's also going to activate toll-like receptor number 4. Fat can do it, and LPS can do it. And it said whether the fat is dietary or whether the fat's just coming from your own adipose tissue releasing fat into the blood. All right, so this is a good reminder of these are all things. I gave a video not too long about a hypercoagulability. So these are things that are making you hypercoagulable. You're more prone to clotting when you're fat. You're more prone to clotting when you eat a lot of fat. You're more prone to clotting when you have leaky gut. You're more prone to clotting when you're iron overloaded. Postprandial endotoxemia is associated with activation of toll-like receptor and insulin resistance. So toll-like receptor 4 activation is associated with increased insulin resistance. So now here's another interesting thing now talking about depression. So MDD is major depressive disorder. And what they're saying is when a person is sick, they often will develop something called sickness behavior, where they kind of want to be left alone. They don't want to socialize. They want to go somewhere quiet and kind of sleep and keep to themselves. And that could be, theoretically evolutionary beneficial to their group, their tribe, if you will, that they don't infect anybody else. It could be theoretically beneficial to themselves, that they get some rest, get some sleep, they're better able to heal. Okay, let's see. Major depression patients are accompanied by activation of the inflammatory response system, and pro-inflammatory cytokines and LPS may induce depressive symptoms. So that's going back to the idea of when you're a little bit sick, you get sickness behavior, and that can worsen depression or make you seem depressed. Okay, and the amounts of serum IgM antibodies and IgA antibodies against LPS were significantly greater in patients with major depressive disorder. Okay, and this may induce specific sickness behavior, and it is suggested that patients with major depressive disorder should be checked for leaky gut. So they're basically saying look at it backwards and forwards. So if a patient comes in there depressed, you should look at first for what's called an organic cause. Maybe there's really nothing going on with them emotionally or not significantly, and their problem is really that they're not healthy and they're in a sickness behavior pattern because they got leaky gut, they got increased LPS in their blood, and they're going through sickness behavior, so to speak. Okay, this one is on the translocation of bacteria and their lipopolysaccharides between the blood and the peripheral locations. Okay, so what this is about is we talked about how when you got leaky gut, you get bacteria into your blood. If there's no readily available free iron, the bacteria will be suppressed and they'll go into dormancy. So now you'll have dormant bacteria. But if you ingest a real highly concentrated in iron meal, if you have iron leaking into the blood for some other reason, let's say a liver injury, then those dead liver cells release iron into the blood, that can reactivate these dormant bacteria. When the dormant bacteria are reactivated, these reactivated bacteria can release their LPS, and that can be, prothrombotic. And as I said earlier, if the patient has a lingering viral infection, viral-related process, that can cause this amyloidogenic clotting as well. And it's harder, again, for the blood to lyse. So this is what I meant, that a wise thing to do is sort of take a list of what predisposes you to clotting, especially if this is a problem for you, and avoid all those things. That's how you get better. So the way stupid people want to get better is say, oh, just give me the pill. Okay? But the way a smart person wants to get better is typically they'll make a list of all the things related to making them sick. And there's pretty commonly 5 things. Sometimes there's 10 things. And just optimize every single one of them as much as you can. And usually the same things that make you healthy for one thing will often make you healthy for another thing, so you can a lot of times simultaneously fix a bunch of problems. Okay, the bacterial requirement for free iron explains the strong coexistence in these diseases of iron dysregulation, LPS production, and inflammation. And you can also see how he was even talking about how one molecule of LPS could lead to 10 to the 8th fibrinogen adapting to beta pleated sheet configuration, predisposing to clot formation, thrombosis. So that's a big amplification. And big amplifications almost are like a vicious cycle that feeds into itself and makes itself worse. Okay, so like I said, to get my serum ferritin down, every time I go for blood tests, let's say I'm going to get my B12 checked or my total cholesterol checked or something, I'll tell them to just pull off a bunch of tubes and discard them because I want to get my serum ferritin down. My eventual goal is get it between about 30 to 80. I'm at about 114. But I'm saying anybody could do this, okay? And try to get more sleep, try to be hydrated if you're kind of worried about these things. All these things. Do all the things that help prevent you from clotting, but it's better to do it by behavior and diet if you can. Sometimes you need to take a medicine, fine, but I'm just saying is I would try to fix things this way first if that was doable. Okay, here's another article. This one is dormant blood microbiome. So that's the dormant bacteria in the blood. And if you have an infectious disease person, tell them, a friend of yours, tell them to watch this lecture and learn something. Okay, dormant blood microbiome in chronic inflammatory diseases. Leaky gut and gums allow bacteria in the blood. So it's not just leaky gut, yeah, it's also leaky gums. You got to take care of your mouth. Okay, we talked about how to do that. I got separate lectures on that. And then when iron, Fe is iron, ferrous, it can reactivate them. The chief origin of these microbes is the gut microbiome, especially when pathogenic. Another source is microbes translocated from the oral cavity, yeah, so leaky gums. We here use the term metapobiosis for microbes that appear in places other than their normal location, yeah, like in your blood. Overall, it seems that many more chronic, non-communicable inflammatory diseases may have a microbial component than is presently considered. Okay, so what they're saying is they think that this is a much more common mechanism of disease than is widely recognized. Okay, and these are some other researchers. Elementary lipemia, so high dietary fat, enhances procoagulation effects, means it predisposes to clotting and inflammation-related problem. LPS plus lipemia means fat in the blood is prothrombotic. Okay, so they were given a fatty meal, and then 2 hours later they were evaluated. When they fed the fatty meal, serum triglyceride levels increased. LPS stimulation in acute elementary lipemia significantly increased tissue factor expression on monocytes, so it made them more prothrombotic. And platelet monocyte aggregates in patients with VF, ventricular fibrillation. Elementary lipemia enhances procoagulatory effects of inflammatory stimulation. Yeah, what they're basically saying is dietary fat is bad, like I said a million times. Okay, so anyways, that's it for this chapter, chapter 16. And so kind of the main point was you want to avoid leaky gut because it predisposes you to clotting. If you've got a problem with a chronic viral related problem, you also want to avoid all these other things so you don't stack up your prothrombotic, pro-clotting risk factors. You want to minimize them all. So you'll help to have your blood not be prothrombotic. That's what you want. So, and iron can do it too. Iron overload can do it. Psychological stress can do it because you increase acute phase reactants like fibrinogen. Okay, and you also have siderophores in the form of your catecholamines. So it's a slightly prothrombotic state to be stressed out. But sleep deprivation makes you also the equivalent of stressed out, elevated catecholamines and cortisol. And so caffeine also elevates the same hormones of stress, catecholamines and cortisol. So all of these things are predisposing to forming clots. And, a clot in the wrong place is a big deal. Heart attack, stroke, blindness, deafness, etc.